I am Dr. Aruna C. Ramesh. I head the Department of Emergency Medicine, Ramaya Medical College. So we work across two hospitals, both Ramaya Memorial Hospital and Ramaya Medical College Teaching Hospital. So currently we are staying in the Garden City of Bangalore, and what we are seeing is the escalating number of accidents and medical emergencies. So across the world, we are seeing that there is a downward trend towards the number of disability and deaths that is occurring because of the early access of emergency care. But though pre-hospital care, which was non-existent, is now improved on by the introduction of 108, still the pre-hospital care, due to our traffic conditions and also probably road engineering systems that are there, the patient to have an early access to medical care is still in a limited area. So we are seeing that the patients are not getting much of first aid treatment at the pre-hospital level and reaching very late to the hospital. So this is an issue where the patients cannot get a definitive treatment within the golden hour, and that's where the disabilities are increasing and also leading to numerous number of deaths, especially in the age group between the around 15 years of age to about 60 years of age, which is the most productive age group in the society for the structural component of a family structure. Now, technology has taken a leading role across healthcare sector, and if you see, what we should be talking about probably is the digitalization in technology and also introduction of this right from the pre-hospital to the hospital care. So we are not able to do this due to the lack of resources in India, but what has happened is at least we are trying to incorporate digitalization and technology implementation into the healthcare monitoring systems once the patient reaches the hospital. Let's say patient has an emergent problem, whether it's a medical emergency, trauma or a surgical emergency. Once the patient comes into the hospital, then we are looking at how we can optimize the patient's condition in the minimal time. So this is where the digitalization and gathering of the data becomes very important. The main challenge actually, I am being a physician in the emergency department, my main challenge is you get a variety of patients coming into the emergency department, and these patients have an emergent problem and they might come in differential conditions. They might be unconscious, they might be brought in by a bystander where I am not going to have any medical history, and here what is going to be most important is the parameters that I am going to get a feedback from, and also my initial assessment that we are going to be doing on these patients, what information it will be able to give us to come to a definitive diagnosis. Even though if I cannot come to a definitive diagnosis, at least it will help me to address the emergent problem. So this is what the digitalization is going to be doing, so that when we put the monitors on to the patients and it is translated either through a Bluetooth or Wi-Fi enabled systems into a digital parameters which I can look at and collaborate it with the assessment, physical assessment that we are doing clinically on the outcome of this patient and also on what treatment I will be able to give to this patient. Okay. Here is where we have actually looked at and been using monitoring systems right from the patient who comes into the emergency department. We have used the stasis monitor, and we are trying to look at how we will be able to incorporate this into the pre-hospital system also. What they are looking at is only the physiological parameters, how you can continuously monitor these patients and help a physician or a nursing staff in decision making. when I say decision making, when the patient comes to the emergency department, looking at these parameters and incorporating, let's say, what is called as a modified emergency scoring system that is going to be there. So, based on 5 to 6 parameters, we will be able to say whether this patient has got an emergent problem. This patient, we can triage this patient and then say that this patient needs to be addressed immediately in a high dependency area or an intensive care unit, or this patient can go into the ward and have a continuous monitoring system at a varied period of time. So, now we are targeting and how we should be monitoring these patients, what is the time intervals at which the patient should be monitored, and at the same time we are also going to be aware of how important it is for us to address the physiological variables that we have identified and how it is going to matter to the outcome of this patient. So, from our experience of utilization of the stasis monitor, what we have realized is patients going into the ward might deteriorate at any point of time due to various reasons, but how will it warn the sister and tell her that this patient is not doing fine? So, this is where early continuing monitoring, the continuous monitoring of this patient and early identification of the deterioration of the parameters will help us to identify a patient who has got an emergent problem occurring in the ward, and we will be able to prevent its deterioration and an event of a code blue occurring in the ward. So, in such situations the nurses will feel more enabled to address an issue once they are able to identify there is a patient deteriorating in the ward, and will be able to give a definitive care for these patients.